If you've recently been diagnosed with atrial fibrillation, this video will explain what it means and how medicines can help.
What is atrial fibrillation?
Atrial fibrillation is when your heart beats in an uncoordinated way. It might twitch, feel out of rhythm, or make you lightheaded. This happens when random electrical signals occur in the top chambers of your heart. This causes your heart to beat irregularly. Clots can form in the heart and be really serious. That's because there is a chance that the clot can travel to your brain and cause a stroke. A stroke happens when the clot blocks a blood vessel that supplies blood and oxygen to the brain. And this is very serious because it could cause damage to your brain or even death. If you have untreated atrial fibrillation, your risk of a stroke increases by 5 times.
How do you stop the clots?
To help prevent this, your doctor might prescribe a medicine that can slow down the process of forming a clot. These are called anticoagulants. Anticoagulants work by slowing down or preventing clots from forming.
Move along this way, please. Single file. Break it up. There's nothing to see.
So, by preventing or slowing down the clot from forming in the heart, it stops it from travelling to the brain and causing a stroke.
Are there any risks?
Medicines come with risks as well as benefits. And if you're taking anticoagulants, it's important to know that if you have a cut, it might bleed for longer. This is because anticoagulants slow down the process of forming a clot. So you might need to apply pressure for longer. You might also find that you bruise more easily. And if you have any bleeding that seems heavy or unusual, make sure you seek medical attention. For example, nosebleeds that won't stop, coughing up and vomiting blood, or finding blood in urine or stools. You should also seek attention for bruising that gets worse or sudden headaches. So yes, by taking anticoagulants, there is a risk of bleeding and bruising, but the benefits of preventing a stroke are far greater.
So what happens if I don't take anticoagulants?
It's really important to take anticoagulants for atrial fibrillation, the way they've been prescribed by your doctor. Remember, untreated atrial fibrillation increases your risk of stroke by 5 times. It's also linked to 1 in 10 deaths and over 200,000 hospitalisations every year. I hope you understand why taking your medicines is so important. As you can see, not taking them can have serious consequences. Don't stop your anticoagulants unless your doctor tells you. I hope you found this information helpful.